Cancer. When you hear the word, what do you think? What do you feel? Is it a scary word? Of course it is. But today, a diagnosis of cancer is not an automatic death sentence. You're about to meet some kids who are living with cancer. And although the road these kids traveled has not been an easy one, it is a road paved with hope, strength, and courage. Come along and see for yourself.
Your life just changes the minute that you find out.
They called me and my family into the hospital, and we sat in a room waiting for the results of the test to come in. And I remember hearing a knock on the door, and the whole group of the oncology team, of the cancer team, came into the room. And I remember just knowing that this was bad news.
When I heard I had cancer, I was just so mad and sad. I was like, how did I get this? Where did it come from? Every time my mom was around, I asked her, am I gonna die? What's gonna happen? Am I gonna die? I just saw my dad's eyes get watery, so I really didn't know what was gonna happen. And my sister was just like looking at me, so I really wanted to cry, but I was really holding it in.
I remember after hearing the word cancer, I took a box of tissues and I just started crying in them and hugging my mom to block out everything else the doctor was saying. And a nurse came over and she was trying to tell me that everything was gonna be okay. And I remember thinking that she really didn't understand. My name is Alexandra. I'm from Brooklyn, New York, and I was diagnosed with bone cancer when I was 7. Cancer is a disease where a group of cells in any part of your body rapidly multiply to form a tumor, and then this tumor can spread or grow in any other part of your body, and eventually it starts destroying what they call the good cells in your body. My treatment was going to be chemotherapy and surgery to remove my right leg. Chemotherapy is different drugs that are used to kill cancer cells in your body, and tumors in your body are made up of rapidly growing cancer cells. So the chemotherapy tries to kill these cells, stop them from growing.
This is your treatment for today.
To give me the chemo, they have to hook a tube up to me. Chemo is very strong. It makes me feel like I'm gonna throw up, like nausea. My name is Dominisha. I live in Bronx, New York. I was diagnosed with leukemia. Leukemia is cancer in the blood.
The way they get the chemo in me is through a line in my chest that goes through my skin and straight to my heart. This is the line, and if you look up here, you can feel the tubing. Right here. My name is Tyler. I live in San Luis Obispo, California. I'm in treatment for cancer in my left kidney. It was the size of a football. It was disturbing. I've been in treatment for 8 months so far, and I have another 4 or 3 to go.
One of the things that the chemo does is make your hair fall out. But when my hair fall out, I thought, what's gonna happen when I go back to school? My friends go back, oh man, she's bald.
When I was on chemotherapy, I never felt good. My name is Lexi. I'm from Lakeville, Massachusetts, and I have a brain tumor which is slow growing.
They told me I had to have chemotherapy to reduce the size of the cancer, and then I had to have radiation and stuff like that. My name's Hector. I'm from Bronx, New York, and I had rhabdomyosarcoma, which was cancer of soft tissue, which happened to be in my eye socket and around the eye. Radiation therapy is, they put you in a machine and it shoots x-rays through the part that you have cancer. The radiation kills the cancer. I do have hope. I'm sure one day my cancer is gonna go away.
I was in the hospital for about 7 months. My name's Tatiana, and I am from Avon, Massachusetts. I was diagnosed with leukemia. I tried my hardest to keep my spirits up and my hope up. I would always brighten my room, decorate it. While I was in the hospital, I made a video.
Welcome to my room. I have these tubes for my body. One's red, one's white. And so they put my medication in this pump, and go into here, and go into my body. And that's how I get my medications.
The whole purpose was to just show my friends my experience in the hospital. I tried not to think about the cancer that much because I knew it was going to be over soon, like happen, and then move on with life.
I am confident that they are going to get all the cancer out, and I won't have to go through this anymore. Chemo kills the germ-fighting cells along with the cancer. Twice a week, they come and test my blood for how many germ-fighting cells I have in it. Can you do this one slowly now?
We'll do it. We'll do it slower so you don't feel it.
When my counts are low, I can get sick quite with anybody near me, but I have to stay home. And it's really hard because it feels like I'm just enclosed in one space and can't get out, which is true, I can't get out. Equals 40.
Very good. And the two division problems.
I have a homeschool teacher come. It's just like school. When my counts are low, I have to wear a mask in public. I don't like wearing it. I try to ignore everybody who stares or looks at me or whispers to somebody else. I just don't feel normal when I wear